Have you ever wondered why the world seems to spin uncontrollably when you move your head, or experience sudden episodes of vertigo when lying down or getting up from bed? This disorienting sensation, known as benign paroxysmal positional vertigo, BPPV, is more common than you might think, yet it remains a mystery to many. BPPV is a condition caused by the displacement of tiny calcium carbonate crystals in the inner ear, leading to intense bouts of vertigo that can be both frightening and debilitating. In today's video, we are delving into the mandatory vitamins if you have vertigo. But before we dive into it, like this video if you're intrigued by natural health solutions, and if you are new here, hit subscribe and enable notification for our latest update. What if I told you that there's a vitamin that could be the key to preventing these unsettling episodes? Yes, there's a little-known secret that could significantly impact your life by reducing the frequency and severity of vertigo. This vitamin plays a crucial role in maintaining the stability of those tiny crystals in your inner ear, preventing them from moving into areas where they cause trouble. Understanding the importance of this vitamin and how it helps to prevent new episodes of vertigo could be the answer you've been searching for. Don't miss out on this essential information that could help you protect your balance and live free from the fear of these bothersome sensations. We've included all the references used to create this video in the description for you to explore at your convenience. Let's dive into the secret that few know about BPPV and how this vitamin could change everything. The lesser-known truth about benign paroxysmal positional vertigo, BPPV, is that it is one of the most prevalent forms of vertigo, yet its underlying mechanisms are often misunderstood. BPPV is characterized by a sudden and intense sensation that the world around you is spinning, particularly when you move your head. This unsettling feeling is caused by a disruption in the inner ear, specifically within the semicircular canals. These canals, which help maintain balance, can become compromised when tiny calcium carbonate crystals, known as otoliths, dislodge and migrate into areas where they don't belong. Once these crystals move into the semicircular canals, they wrongly stimulate sensory cells, leading to the sensation of vertigo. The term paroxysmal refers to the abrupt and severe nature of the vertigo episodes. Positional indicates that these episodes are triggered by changes in head position, and benign suggests that while the condition is uncomfortable and can be debilitating, it is not life-threatening and can typically be treated effectively. BPPV is more commonly seen in older adults but can affect individuals of any age. Although the episodes are brief, often lasting less than a minute, they can be extremely distressing and impact daily life. It's also possible to confuse BPPV with other forms of vertigo, such as Meniere's disease, making accurate diagnosis crucial. Proper identification of BPPV is key to accessing the specific treatments that can provide quick and significant relief, thereby improving the patient's quality of life. While the exact cause of BPPV is not completely understood, it is closely linked to the abnormal movement of otoliths within the semicircular canals. Under normal circumstances, these crystals are housed in a structure called the macula, located in the utricle, where they contribute to maintaining balance. However, when these crystals become dislodged and move into the semicircular canals, structures responsible for detecting rotational movements of the head, they create a false sense of motion, which triggers vertigo. The displacement of otoliths can happen for several reasons, with aging being one of the most common factors. As we age, changes in the inner ear structure make these crystals more prone to dislodging, leading to BPPV. Stay tuned as we delve deeper into the mandatory vitamins if you have vertigo. Remember to like, share, and subscribe to support our channel and stay informed about your health. Other factors that can lead to the displacement of these tiny crystals include head trauma, which can jolt the crystals into the semicircular canals, and a history of vestibular diseases. In some instances, benign paroxysmal positional vertigo, BPPV, may develop after an ear infection or even following prolonged bed rest, such as after surgery. Although it is often challenging to pinpoint a specific cause, Understanding these contributing factors is essential in diagnosing and managing BPPV effectively. Being aware of what might trigger episodes is crucial for preventing recurrence and for using repositioning maneuvers, like the Epley maneuver, which can realign the crystals and alleviate symptoms. Identifying BPPV can be tricky, as its symptoms often resemble those of other vertigo conditions. However, there are distinct signs that can help in recognizing this condition. The primary symptom of BPPV is intense, short-lived vertigo that is triggered by changes in head position, such as when lying down, getting up from bed, looking up, or turning over. These episodes typically last less than a minute, but the sensation of imbalance may linger for some time afterward. Another key indicator is nystagmus, an involuntary eye movement that occurs during a vertigo episode, signaling that the semicircular canals in the inner ear are being abnormally activated, as seen in BPPV. Clinical tests, such as the Dix-Hallpike maneuver, are commonly used to provoke nystagmus and confirm a BPPV diagnosis. If you experience vertigo episodes related to head movements, it is crucial to consult a doctor, preferably a specialist in otology or balance disorders. Accurate diagnosis is vital for receiving the correct treatment, which can alleviate symptoms and significantly enhance your quality of life. Even if the episodes are brief or infrequent, don't ignore them, as BPPV can be easily treated with appropriate maneuvers. The Epley maneuver is a simple yet highly effective technique for repositioning the displaced crystals in the inner ear, used in the treatment of BPPV. This maneuver involves a series of specific head and body movements that use gravity to guide the crystals back to their correct location in the macula, where they can no longer cause vertigo. The procedure can be performed in a doctor's office or even at home with proper guidance. Although the Epley maneuver is often effective after just one or a few sessions, doctors may advise avoiding certain head movements for a period after the procedure to prevent the crystals from dislodging again. In addition to physical maneuvers, recent studies have highlighted the important role of vitamin D in managing BPPV. Vitamin D is essential for bone health, including the formation and metabolism of otoliths, the small calcium carbonate crystals in the inner ear. Adequate levels of vitamin D help prevent these crystals from dislodging, thereby reducing the risk of BPPV. Research shows that individuals with a vitamin D deficiency are at a higher risk of developing BPPV and that those who already suffer from the condition are more likely to experience recurring episodes if their vitamin D levels are low. Supplementing with vitamin D or ensuring adequate sun exposure has been shown to decrease the frequency of new BPPV episodes, making it a valuable preventive strategy for those at risk. Maintaining optimal vitamin D levels is a simple yet effective measure that can significantly improve the quality of life for BPPV patients by reducing the incidence of vertigo and the need for repeated treatments. Recent research has highlighted a significant link between vitamin D deficiency and an increased risk of developing benign paroxysmal positional vertigo, BPPV. This connection arises because inadequate levels of vitamin D can weaken the structural integrity of otoliths, the small calcium carbonate crystals in the inner ear. When these crystals are weakened, they are more likely to become dislodged and migrate into the semicircular canals, which can lead to the onset of vertigo. Furthermore, restoring adequate vitamin D levels has been shown to diminish both the frequency and intensity of vertigo episodes, making vitamin D a crucial component in the treatment and prevention of BPPV. For individuals suffering from BPPV or those at risk of developing it, ensuring sufficient vitamin D intake is essential. This can be achieved through proper supplementation, increased sun exposure, and consuming foods rich in vitamin D. Consulting a healthcare provider to check vitamin D levels and considering supplementation if necessary can be a critical step towards alleviating symptoms and preventing future episodes. Understanding the triggers of BPPV is also vital. The primary cause of BPPV is the displacement of otoliths into the semicircular canals, which occurs due to various factors. Aging is a significant risk factor as it can alter the structure of the otoliths, making them more susceptible to dislodging. Head trauma, even minor, can also displace these crystals. Additionally, ear infections, prior vestibular conditions, and extended periods of bed rest, such as after surgery, can increase the likelihood of developing BPPV. Common triggers for vertigo episodes include rapid changes in head position, such as getting out of bed or tilting the head back. Awareness of these triggers is crucial for preventing new episodes and managing the condition effectively through treatments like the Epley maneuver. While BPPV can affect people of any age, certain groups are at higher risk. The primary risk factor is age, with the condition being more prevalent in individuals over 50. The deterioration of the inner ear structures with age makes the otoliths more prone to dislodging. Other risk factors include head trauma, a history of ear infections or vestibular diseases, and vitamin D deficiency. If you belong to these risk groups and experience vertigo related to head position changes, consulting a doctor is important for proper evaluation and early diagnosis. Early detection allows for effective treatment, which can significantly improve quality of life. Recognizing the symptoms of BPPV is essential for diagnosis. This vertigo is often described as a sensation of the environment spinning and may be accompanied by nausea, imbalance, or vomiting. Another telltale sign is nystagmus, an involuntary eye movement observed during vertigo episodes. Nystagmus occurs due to the abnormal stimulation of the semicircular canals. It can be detected by a doctor during an examination or noticed by the individual as difficulty focusing their eyes. Additionally, some people with BPPV may experience lingering feelings of imbalance or instability, especially when walking or standing, which can persist for hours or days but are generally temporary. If you experience symptoms of benign paroxysmal positional vertigo, BPPV, it is crucial to seek medical evaluation, as the condition can be effectively treated to relieve symptoms and prevent future episodes. The treatment for BPPV is typically highly effective and primarily involves repositioning maneuvers, such as the Epley maneuver. This technique is designed to reposition the dislodged otoliths back to their proper location in the inner ear. These maneuvers are performed by healthcare professionals, including doctors or specialized physical therapists, and involve a series of head and body movements that use gravity to guide the crystals back to their correct position. Often, a single session of this treatment can resolve the symptoms, though some patients may require additional sessions. After undergoing these repositioning maneuvers, it is common for doctors to recommend avoiding sudden or abrupt head movements for a few days to help ensure that the otoliths stay in place. In cases where BPPV persists despite repositioning maneuvers, medications may be prescribed to manage symptoms like vertigo, nausea, and vomiting. However, these medications do not address the underlying cause of the condition. For patients with vitamin D deficiency, supplementation may be advised as part of the treatment plan. Adequate levels of vitamin D have been linked to a reduced risk of BPPV recurrence. In rare instances where repositioning maneuvers are ineffective, surgical options may be considered, though such cases are uncommon. Early diagnosis and appropriate treatment are essential for relieving symptoms and preventing BPPV from recurring, which allows individuals to return to their daily activities with confidence. Identifying BPPV accurately and distinguishing it from other types of vertigo is vital for applying the correct treatment. The Epley maneuver, being both simple and highly effective, is a key component in the management of BPPV. Additionally, maintaining adequate vitamin D levels can strengthen the otoliths and help prevent recurrence, while understanding and avoiding triggering movements can further reduce the risk of vertigo episodes. In summary, BPPV is a manageable condition, and with the right treatment strategies, effective relief and prevention are achievable. If you or someone you know is experiencing vertigo symptoms, don't hesitate to seek medical advice. A proper diagnosis is the first step toward restoring balance and peace of mind. If you found this information helpful, please hit that like button and subscribe to our channel if you have not already. Your support helps us reach more people who can benefit from these health insights. Wishing you continued health and happiness. See you in the next video.